Lascan Corla, I move the motion in my name and that of my colleagues. As Ireland's population grows and ages, pre-hospital emergency care is facing increasing pressure to adapt. And the staff within the service are more than willing to meet that challenge. The National Ambulance Service has come a long way from the days when it was just a transport service, transporting patients to hospital. The role of the paramedic has changed from being an ambulance attendant to a specialised healthcare worker, involved in the delivery of advanced, out-of-hospital emergency clinical care, which is vital to proper functioning of our health service. Paramedicine is, however, not considered a profession by the biggest employer of paramedics, the Health Service Executive. In many countries, the paramedic is increasingly seen as a healthcare professional, but in Ireland, the full potential of this role has yet to be realised. Paramedics are classified as emergency medical technicians, EMTs, healthcare workers on the same pay grades as cleaners and domestic staff. They are not aligned to the medical pay scales and remain among the lowest paid clinical disciplines in the country. Currently, the titles of paramedic, emergency medical technician and advanced paramedic are not protected. This means that anyone can call themselves a paramedic, even if they do not have the qualifications or experience to provide safe and effective healthcare. This lack of professional recognition makes it very difficult to retain staff or to recruit new ones. Paramedics themselves have said that they could do much more, but their role needs to be clearly defined and legislated for. One of the areas where they could provide more care is in the delivery of community paramedicine. But for this to happen, the community paramedic needs to be recognised as a distinct clinical role, with more autonomy and the ability to prescribe medication, as is the case in other countries such as the UK. Recognition of paramedicine as a profession with degree-level training and protection of the title will give our healthcare system a trusted extra set of hands to relieve the pressure faced by our emergency departments every day. Giving more scope for paramedics would mean that more people could be dealt with in their community and in their own homes, providing alternatives to appropriate clinical circumstances to overcrowded GP surgeries and emergency departments. Paramedics, and especially community paramedics, could be the link between communities and services such as social workers, community healthcare nurses, pharmacists and GPs. They could even revitalise the home visit role that was once performed by GPs. In Europe, North America and Australia, community paramedicine programmes working, for example, with older people or more vulnerable members of the community have resulted in up to a 50% decrease in patients being transported to emergency departments. To make this happen, we want a commitment from government to establish a commission on paramedicine, to transform their role, just as has happened in nursing. The nursing profession today is now properly recognised as an equal clinical partner within the health service, rather than historically seen as an attendant to the doctor. As a matter of urgency, the Commission on Paramedicine needs to examine issues such as A, the recognition and regulation of paramedicine as a profession with appropriate primary legislation. B, the expanded scope of practice and specialisms for paramedicine need to be clearly set out. C, appropriate initial and ongoing education for all paramedics. We must move from the voluntary to third-level education within the profession so that it is aligned with the current and future needs of our health services. And finally, the Commission on Paramedicine must address the recruitment, retention and career progression issues. More staff are needed due to the increasing demands, but this will not happen as long as paramedicine is not seen as an attractive career option. And in conjunction with that, pay scales for current staff need to be aligned with the medical profession to reflect and reward the increased responsibilities in the role. Paramedics could play a vital role in the community. They are trained and experienced, but they need the support. The role needs to be recognised and regularised and protected. It needs consistency of training and an alignment of pay in accordance with its responsibilities, and a commission on the future of paramedicine could make that happen. Thank you.